Hi everyone, Liz Giresi from 94.3 The Point, and so happy to have you with us. What a special guest we have in just a moment or two. In fact, he's hopefully connecting right now, and we're going to talk to him. This is something that we rarely hear about from the inside, from somebody who's actually been through it, coronavirus. And so, let me see if I can get Dr. Mike on right away. Give me a second to connect with him. So we're so blessed to have him with us, and this is the first interview I think that he's doing since this all happened. So hopefully we'll get him on in a second. Let me try again. He's here. I'm just trying to get him. Let me add. Come on. See if that works. He
There he is. There he is. Hi, Liz.
How are you doing today?
Well, I'm breathing on my own. That's very good.
Huge. Uh,
Yeah.
we've been following along with your story, your amazing physician wife, Denise. I'll just give a quick background to keep you so hang on to your breath. The background for those who haven't been following is that Dr. Mike here, who lives in Homedale, is an ER physician, first responder, frontline hospital worker saving lives. And when you realized you had the virus, you tried to treat from home because you didn't want to take resources away from anyone else, knowing firsthand how important it is to for the people that are truly sick. But you ended up being one of them. You had to finally check into the hospital, and we got to watch your battle. And with a sense of humor on top of it all, but must have been such a scary time. And so many thousands of people from around the world are following you now, and we're praying for you. You can see the story and connect with Mike directly on our Facebook and website, but we're so blessed to have you here on Instagram Live today. So, can you tell people what it's actually like to go through something like this?
Well, thanks for having me, Liz. This is great. Wow, this is my first interview, only interview, really.
Thank
And I just want to thank my PR manager here, Dr. Wunderler.
you.
But well, early on, um, like early mid March, when I was still working shifts, I remember, we heard about it, and then I heard about all the risk factors for people getting sick, of obesity and hypertension and being a healthcare worker. So I knew right away I was doomed. It was going to be me. I got all those things wrapped up into this. So it was just a matter of time. So right around mid March, um, we started seeing some pretty sick patients, but we were sending patients home. There really is nothing you can do. There's no cure, And you got to think back. It's a much different world today than it was March 10th, 11th, 15th, somewhere in there. And I spiked a fever. I remember I worked a shift. I worked like a Sunday shift, and then the next day, I think it was the next day. Oh no, I had fatigue first. Like unrelenting, amazing fatigue. Now I'm an ER doc. I'm always fatigued. It's just what we do, right? But it was worse. And then I had that fever, and I said, man. So I text my boss. I said, man, I think I got this. And then, and yeah, I spent 12 days at home. So I tried. I struggled for 12 days, roughly.
And isolating from your family, even at home, so as to keep your two young children at home and your wife from getting it. So you know firsthand how you could have tried as hard as you could, but there came a point where, how did you know when you had to go to the hospital?
But, good point though about I self isolated before I had symptoms, maybe a week or so before, 5 days before. I said, we need to keep you guys safe. So, and that was at the behest of Denise, actually. So that was, really, really smart on her part to say, you're going to sit in that room for a while. And then, so then I had the fever for 12 days, fevers up and down, the fatigue, the cough, the shortness of breath, lost my sense of smell around day 5. I don't know what's going. I was like, this is awful. And then, of course, I got tested, and it took about 5 days for me to get the positive test. But I knew. So it was about day 12, and what it was What had changed was I was still struggling, and we had oxygen here. I had my incentive spirometer. I have the nebulizer treatments. I was on some meds already, but the chest tightness, and I knew that my inspiratory rate was going up, my heart rate was going up. These are all ominous signs in an ER setting. I see this all the time. And I couldn't get the full breath in. And the chest, it felt like somebody somebody was just squeezing the chest. I said, I don't know if I'm gonna make it another night here. And I just did. I thought to myself, I didn't want, it was Saturday. I said, I didn't want Sunday to come along. Because remember, I'm in my own part of the house, and Denise like kind of knocks on the door, and I'm cold and dead the next day. Really, I just didn't. I was like, she doesn't need that. I said, if I'm gonna die, let me go to the hospital. So, and get that out of the way.
We're even thinking that. I remember her saying that you were you were asking her how many more minutes as she was driving you to the hospital. Like, you didn't even think you would make it to the hospital at that point.
That was bad. That was awful. Wow, that was awful. You're right. Well, I thought I was going to pass out because I knew the respiration rate was going up, but my tidal volume was going down. I was it's really, really just trying to get in, and I was cranking up that oxygen. I had like 6-8 liters going on an oxygen. I'm like, oh man. And then I'm thinking to myself, if I pass out in the back, I don't want her flipping out. So I was like, how many more minutes? Yeah, it was quite a struggle. Oh, it was awful. And what was weird is that, especially at night with the fevers, and then and I made some recordings of this, so later on, assuming I survived this, I could listen again. And what we call in the ER death rattles. It's when somebody is really not doing well. A lot of times it's someone who's on comfort care, advanced lung disease, and every time they breathe out, it's all these crackles and pops and wheezes and things. And I heard that in myself. And I remember hearing that on the way to the hospital. I'm like, this is not good.
And then and now you're talking to Denise as best you can when you're able to catch up to talk. But I remember hearing that you said to her, you were able to hear down the hallway to when somebody else was getting intubated or bent. So that can be good for your psyche, even, to be surrounded by that.
Yeah, the way where my room was, it was positioned so I could see out kind of down the hall. And a couple of the nights, you'd hear the rustling of people, and I know the sounds of a hospital. I know what's going on, the bells and the thing. And then you'd see somebody being rolled over, and they were intubated, and because I was on a non-intubated floor. I was like, I don't know, some kind of mid-level floor, just telemetry, pretty much. And they monitored the oxygen with the high flow oxygen. Yeah, I didn't know which way it was going to go. And I'll tell you, I got so tired. And what people don't realize is when you're breathing so much, I'm considered young in a hospital setting, so I have pretty good reserve. But after a while, as you get older, it gets harder. You can actually tire out. Your breathing will tire out. Your CO2 levels will go up. Your oxygen levels will come down, and then that's it. Then the only way you're going to breathe is someone puts a tube down your throat. So the doctors would come in and say, I was struggling so much to breathe. I could barely talk. I could barely walk. I'm trying to prone. I was miserable for a good 3, 4, 5 days. They'd say, you look great. I said, compared to what? A corpse? This is terrible. I can't breathe. They said, are you kidding? We got 80 people on vents over there. They're in their 70s and 80s. And I'm like, wow, it really puts it in perspective. It really does. And I'm glad they didn't intubate me because ultimately I just needed to struggle through it.
And it was a struggle. You were so out in the open for people that follow you worldwide with humor and trying to even show pictures of yourself struggling for breath. Did it help? Did it seem to help to know there were so many people rooting for you and praying for you? And how's your state of mind when you think about those kids at home, having just recently lost your youngest daughter very suddenly to unexplained death, which is also in the stories on our website?
Yeah, it was very very heartwarming seeing people saying, go Dr. Mike, people from work and social and people I, haven't seen in 40 years. It was very nice. It's very touching. It is very uplifting. I'm in a little different world. I didn't care about death. I'm just going to be honest with you. The thought of me dying from this, it is what it is. I was okay with it because of loss of my daughter from 2 years ago. It takes the wind out of your sails. It is a soul crushing experience. I said it is what it is. If I die, I die, and it's terrible for, of course, Denise and the kids and the friends and the family. But it is. I was ready for it. What I don't like and I didn't like was the struggle getting up to that point. Wow, boy, that was awful. That's no way to live. No way to live. Trying to breathe and struggle. So yeah, it was very nice. People on like Facebook and texting me saying, hearing about you. I hope you're doing okay, kind of thing. That's great. It's always good. It's always fun and uplifting. It probably had a positive effect in me getting better. Because I get that question a lot, Liz. What do you think helped? I have no idea. I'm on 20 meds and supplements. I have no idea what it was. I was on an experimental drug. I was in a study. So it's one of 3 arms. So I may or may not have gotten the drug. Who knows?
What do you have to say as a doctor now to help us understand this? Are there different strains? I mean, we hear that some people get nothing but a little cough and a little fever and then they're done, and others who, even younger, maybe because of their other problems, don't make it. What is there such a wide variety, and what's your message to people?
I think there is. I'm sure they'll eventually figure out that there's more than one serotype of this virus. But it's, I'm sure there's genetic predispositions to things. Some people just don't have the lung reserves and they don't realize it because they go about their normal day and there's no insult, as we say, an insult to their body, like a bad virus like this. And until you get it, you don't know. I have had people contact me saying, hey, doc, like friends from years and years ago who've heard my story, and they said, doc, I got a fever of like 101 and I'm scared. I said, don't be scared. I said, you do what you got to do. You just, if you take a little Tylenol for your fever, if you have a nebulizer at home, it might help open up the lungs. And I say, rest assured, don't they say 80% of this disease is pretty mild? Then you get maybe 10% like me who are kind of, on the sick, but not critically sick, who have to struggle through it. And then, of course, there's the 10%. You can't predict it, evidently. And it's interesting because I've been home or in the hospital. I haven't been on the front lines in almost a month. Wow. Oh, I have an exclusive right here for you, Liz.
Okay.
First time, guess what? I am going back to work on Sunday. How about that? Look at that. Because I'm going nuts over here. I'm bored out of my mind.
You're going to have bedside manner that nobody else can have, though, as a survivor of this. I cannot believe how quickly you've gotten your lung capacity back and that you're willing to go back out on the front line. Thank your family for letting you.
Yeah. Yeah. I had to check with the boss first, actually. So, i.e. Denise. But, yeah, no, I'm excited about going back. Yeah, this is what I do. I enjoy what I do for a living. I really do enjoy it.
Those that are watching.
Excuse me?
Or do you work at for those that are watching?
I'm sorry. You just cut out again.
What hospital are you?
Oh, I don't really talk about I work at 2 hospitals. I really don't mention it. I work one in Jersey, North Jersey. I also work in Kentucky as well. I float. You know why? Because a lot of docs are getting in trouble now. They're getting fired for mentioning their hospitals. I don't want that kind of hassle, but it's a regular hospital, ER, typical volume kind of thing. And so yeah, I don't really even mention it, but yeah,
that's fine. I know I have to let you go soon, but I wanted to ask, we're learning more things about this virus every day. Is it true that you have immunity once you've had people maybe immune and didn't even know they had a mild case, maybe as far back as December, January? Is that found to be true so far?
I hope so, because I don't want to go through this again. And I'm going to be out there, and the little viruses are going to get through the mask. I'm sure. I hope not. I hope I don't get sick again. So, but that's a good question. I don't know. I mean, if you think about it, if there are multiple serotypes of this virus, if you get one, why can't you get the other one and still get sick? I don't know, and I don't think anybody really. I don't think the real smart scientists who are much smarter than me know that either. And the big question I get is, well, are you going to start donating your plasma? Well, I don't know if I'm actually cured of the virus right now. It might still be floating around in there. But eventually I'll probably get a couple of tests, negative tests, and then, sure, I'll start donating plasma. If it helps somebody else, you take as much blood as you want from me.
And what's your advice for people that most people are following the rules, but when you reach the point where there's nothing left in the fridge and you have to go to a grocery store, or you find that you have to go do some sort of business, is it safe enough to have a bandana around and gloves on and then come home and change and wash? Is that the best you can do?
Originally, about a month ago, I remember people were saying, oh, just wear something on your face and stuff. I said, that's ridiculous. The virus particles are so small. They'll get through all this stuff. Unless you have a PAPR, a special kind of a hooded mask, or an N95 mask, it's worthless. But now I'm thinking, well, there might be something to it. There might be something, at least some of those droplets, if somebody sneezes, maybe it won't get through. Yeah, I think that's the best you can do. The age-old wash your hands is always good, because we do touch our face more than we think that we do. I touch my face all the time, and you don't realize it. And who knows? For all I know, I was at work, and I touched the table, and I touched my face, and I got it. Who knows? So I think all that, whatever you're seeing about just trying to stay away from other people, other humans, I think is probably pretty good. But if you got to go shopping, you got to go shopping. Just make it quick, in and out of the store.
And what do you have to say for those hospitals? What are they short on supplies? Like, what is their mentality? What can we do to support those on the front lines?
Well, I think the hospitals, there's been quite a learning curve over the past month, huh? Wow. And, you go from wearing the flimsy surgical mask to a huge outfit. Actually, one of my colleagues she texted me a picture of herself, of what she's wearing, and it's completely different than when I was there. We had just the N95, but now she's got a whole, it looks like a hazmat outfit. So I think it's a matter of a lot of hospitals. I think we were all kind of surprised by the intensity of this. Hospitals, docs, nurses, everybody, the paramedics, but we're learning. So when I go back to work, I'll just be like, well, what do we have? What can I wear? Give me what you have. Because if you don't have it, you can't wear it. It's as simple as that. So hopefully, I think supplies are probably getting better. I watch the news like everybody else. I think so.
All right. Yeah. Question is a question to you. What have I forgotten to ask you? Or is there something that you want to say that I forgot?
Okay. If you think you're going to go into the hospital, if you're a guy, for instance, shave your chest and arms before you go in. No one's going to tell you this, Liz, except for right here. This guy's going to tell you. Why? Because that hair is going to come off your chest and arms whether you like it or not. Because they put all these stickies on you. And I know it seems kind of trivial, but boy, when they're ripping everything off at the end of your hospital stay, you're going to thank Dr. Mike for shaving your chest and your arms. Right there. That's it.
There's the humor.
It's the takeaway message right there.
Thank you so much. We love having you on.
Well, it's great. Thanks for having me. This is fun.
If you want to come on, you are more than welcome. And
great
as well.
Oh, one more thing. Let me see. I'm going to check my pulse ox. I'm going to check my oxygen level. Okay. All right. Let's see how I did with this interview. 97%. Cured.
Our superhero.
Stop.
World.
Stop. All right. Well, thanks a lot, Liz. All right.
It's been Have a great day. Bye-bye.
All right. Take care.